perceived barriers to emergency obstetric and neonatal care in Jimma and Asandabo, Ethiopia, presented the results of this research in 5 areas: feedback, resources, training, environment, and self-perception. One of the key findings is that health workers in the more rural areas reported that they needed training to identify the signs and symptoms of an obstetric emergency. Also key to an emergency response is a vehicle to transport patients to the next level of care. It is hoped that the findings of this research can assist the Ethiopian health system in addressing the training and structural needs to lessen the burden of maternal mortality. And I just want to mention, so I worked with Jessica in pulling this together, pulling together her research into the capstone paper and then for presentation. And so, you know, for a lot of students, and Jessica's in the joint physician assistant MPH program, you know, research is really difficult, and pulling all of your findings together, sometimes gathering your data is the easy part in a way, and really making meaning out of it can be really challenging. And for those who know me, you know I ask a lot from students. So Jessica really rose to the occasion, and so she worked really hard on her project, and even as we were working on sort of shaping her data into the finished product, I could just see the growth in her research capacity, you know, and really understanding sort of the context, the larger context of the research she was doing, what the meanings would be in the future, and also appreciating the limitations of doing research. That, you know, really, that makes you a good researcher if you understand, wow, there were a lot of pitfalls, there are a lot of things I do differently next time, you know, if I do a similar project. And so that just showed a tremendous amount of growth. And so, so I anticipate great research from Jessica in the future, and so we just wanted to acknowledge her great work on her research project. So please. Yeah.